diagnosed in more than 50,000 Americans each year. We spoke to Dr. Janet Chance of Hoag Memorial Hospital Presbyterian in Newport Beach to learn about Parkinson's disease and their movement disorder program for their patients.
Parkinson's is a brain disorder, and there are really two groups of symptoms. Some are motor symptoms, and some of them what we call non-motor symptoms. It's a degenerative disorder, and by that we mean that a part of the brain is damaged and continues to deteriorate. And at this point, we really don't know what causes it. There's a lot of ideas, there's a lot of work being done in the lab, but nobody's really honed in on exactly what causes this.
We asked Dr. Chance to name the most common symptoms.
The commonest symptom that people, I think, are familiar with is the tremor. And there are four what we call cardinal symptoms of Parkinson's: tremor, stiffness, slowness of movement, and difficulty with balance. The tremor typically is when the hand is still or resting, and it's what we call a pill-rolling tremor, where the thumb rotates across the fingers. And it's so-called pill-rolling because in the old days, pharmacists used to make their own tablets and they would roll them between their thumb and fingers. It usually starts on one side, but it may be on both sides. Another very common symptom is rigidity or stiffness. And typically when I examine a patient, I move an arm up or down. It's a nice, smooth, fluid move. With Parkinson's, it's a stiffer, kind of ratchety movement that we call cogwheeling. And that's very typical of Parkinson's. It can be seen with other types of tremor, but it's really most commonly seen with Parkinson's. Slowness of movement is one of the very, very disabling symptoms. And typically patients will interpret it as weakness. They can't do what they want to do. But when you examine them, they have the muscle strength, but the movements are very, very slow. It makes it difficult to roll over in bed. It makes it difficult to stand up from a low chair, to get in and out of a car. Things like doing up buttons become very difficult. Handwriting becomes very difficult. Typically, the writing becomes much smaller in size and much more cramped. The last of the four major symptoms to develop is difficulty with balance. And a lot of these patients have a great deal of trouble and they fall. And when they fall, they go down with a crash.
We asked Dr. Chance to tell us how Parkinson's disease is treated.
It's a multidisciplinary approach. The mainstay of treatment is medication, there's no question. Back in the day, we used to say, because of some of the side effects of the medication, we should avoid treatment until the patient finds the symptoms are disabling. Well, we've changed that now because we find that patients who are treated reasonably early tend to do better for longer than the patients who avoid treatment at all cost. There's very, very good data now that shows that intense exercise is beneficial to patients with Parkinson's. It has a significant effect. And I think it's absolutely key. I think you cannot manage these patients without doing it. When I have a patient come in who's newly diagnosed or I'm seeing for the first time, I automatically have them go to get physical therapy, occupational therapy, and speech therapy.